Good afternoon, guys. I hope we're all sparkly. I think it's safe to say that the field of testosterone deficiency and subsequent TRT is not an area of medicine that the traditional healthcare system is particularly interested in. Why is that? Is it because you walk in looking like an otherwise healthy male? In part. Is it because you have a beard? Hairy legs? My word, honestly, talk about judging a book by its cover. What matters is inside. Inside matters. Why does this not apply to testosterone deficiency, but applies to every other field of medicine? Peculiar. Is it because of the association with anabolic steroids and performance enhancement? Obviously, in part. Is it to do with testosterone being promoted as a lifestyle drug? Jump on TRT. In part. What's the problem with wanting to optimize your health? Yeah, what is the problem with wanting to optimize your health? Now, as we've said before, testosterone deficiency should be a diagnosis of exclusion. You should look to address reversible causes. Stress, sleep, nutrition, exercise. You should look to exclude other pathologies because going on TRT is a pain. It's not a literal pain because, as you guys know, we subscribe to daily microdosing of TSIP and HCG, and it's in the subcutaneous tissue using a 29 gauge insulin needle. It is essentially painless. It's just a little prick. Honestly, if a young diabetic can inject 4 times a day, man up, treacle. Honestly, the look on people's faces after I give them their first injection is priceless. I can assure you it's painless, but until you have your first injection, you're gonna have that anxiety, and when you have the injection, shoulders always drop. It's comical, really. So, what are you worried about? Well, it's a commitment. TRT should be seen as a lifelong commitment. You shouldn't go on TRT unless you need it. So what the hell does that mean? Is it a need defined by the medical profession? These guidelines state you're okay, you're within range. But if the guidelines don't take age into consideration and biological individuality into consideration, perhaps a testosterone of 12 is not optimal for me. Perhaps if I'm trying to reduce stress, my sleep's on point, my nutrition's on point, etc., etc., this is not a testosterone level that will allow me to do what? Well, as we said before, the premise behind this whole thing is to normalize physiology for optimal well-being, to help you improve your physical and psychological well-being. It is just the foundation. So you have to work, how often every day, on your physical and mental well-being. And if the destination is death, enjoy the journey. There's a wonderful talk from Alan Watts who talks about the symphony. If the point of the symphony was to reach the end, the best composers would be the quickest composers. Makes no sense, does it? So you have to enjoy the journey. You have to enjoy the journey by what? Earning your reward. By putting effort in to achieve reward. It's all about goals, little goals, day-to-day goals. You might have some big goals, and you should have some big goals, and you should be working towards them. But once that goal is achieved, you need to move on and find another goal. Perpetual movement. Life is about perpetual movement. Now, without challenges, and if you were given everything that you ever wanted, wouldn't life be tragic? It's like the super rich, isn't it? Are they any happier? Well, if you can have anything, does that not sound perfect? Well, it's not perfect, is it? You haven't put any effort in. It's like the rich kids driving around in their daddy's Ferrari. Do they fully appreciate that Ferrari? My first car was a Citroen AX. I loved it. Absolutely loved it. Because I earned it. My first watch, a Tissot watch, back in 1997, my first paycheck. Wasn't super expensive, but I love that watch because I earned it. So we focus too much on materialism because we're supposed to, according to everybody else. No, utter bollocks. We should be concentrating on self-improvement and being a productive member of society. Humanity. Doesn't matter what you believe, as long as you are true to yourself and true to others and the world, you will have a positive impact on society and humanity. So TRT will hopefully give you that perspective. Will it? That's massive, massive overstatement, isn't it? It's going to give you the foundation to do what? Yeah, earn your reward. Nothing more, nothing less. So don't go on TRT unless you need TRT. And don't expect TRT to put the work in for you. As I've said before, you can still see the glass as half empty or glass half full. It's perspective, it's choice, it's up to you whether you want to stay miserable or crack on. Now, the foundation hormones are integral to physical and psychological well-being. There is a chronicity about hormones. You don't need to be reactive. Your autonomic nervous system and your brain is reactive. Without the foundations, they're struggling. So put the work in and you'll see the reward. TRT should be considered a lifelong therapy. But if you wanted to come off of TRT because you didn't see the benefits that you wanted to see, normal physiology, well, unless your dose hasn't been carefully titrated according to effect, then that is just TRT, then you will suffer consequences as a result. You no longer produce the testosterone from your HPG axis unless you've been using HCG. Now, there are many reasons to use HCG. Helps preserve testicular size and function, fertility. It helps the neuroendocrine system work. So you'll hopefully see a sense of well-being and libido that you won't see with just testosterone monotherapy, which is perhaps the reason why some people don't get on with HCG alongside testosterone. And I believe that's due to exogenous factors, because HCG is constantly stimulating the testicles, not like LH, which is released in a pulsatile manner. So the neuroendocrine system is being constantly stimulated by HCG. Now, we need that because of pharmacokinetics and pharmacodynamics. Having an LH analog would be absurd. But there's a very small proportion of guys that don't get on with HCG. But HCG should be in your protocol, ideally. So we think of TRT as HRT, hormone replacement therapy. So if, for whatever reason, you wanted to come off TRT, you would stop the testosterone but continue the HCG for a couple of weeks to then allow your brain, which recognizes the signals that you've got low testosterone again, to hopefully send LH down to the testicles, to the functioning testicles. Obviously, you can use a medically supervised restart protocol. That is a bit of a roller coaster, bit of a sledgehammer, can be effective, but not always. Because why did you go on TRT? Because you needed it. So you suddenly reversed all of the issues that caused your low testosterone. Now, if you've got a pathology, how are you going to do that? If it's because of lifestyle, diet, exercise, and it's taken 20 plus years to get to this state, and you think 6 months on testosterone replacement therapy has now cured that, and you can jump off TRT, much like you jumped on TRT prematurely, and feel great, well, no chance, because testosterone levels do decline with age. And if you've had a reversible cause, you should have addressed that before starting TRT, because you won't feel the benefits of TRT unless you need TRT. So the decision to start should be carefully considered by you and your prescribing doctor. We have so many people say, yes, I qualify for TRT, but I'm not sure it's the right thing for me, because they haven't had that discussion with somebody who could be objective. They go to these online providers who go, yeah, you qualify for TRT, jump on TRT. But they haven't been fully counseled. They have a million questions. And because they haven't been seen face to face, they have no assurance or reassurance that testosterone replacement therapy is in their best interests. And somebody is there to be objective, to say, actually, I don't think TRT is. I think you should do this, this. Or give you the assurance that it is and support you on your journey. To what? Yeah, one more time. Earn your reward.